Moving on to the next session. Please join me in welcoming the esteemed Dr. Mukta Umarji ma'am, MBBS, DGO, MD Obstetrics and Gynecology, a highly respected and beloved gynecologist who has been a motherly figure to all of us in BMA and gynecology community. With an illustrious career spanning over 40 years, currently practicing at Umarji Hospital, Baner. She is the past president of Pune OBGY Society, POGS. Welcome, ma'am. I have enabled her to provide valuable insights and guidance to these patients. Welcome, Dipali. May I request the chairpersons to please introduce the speaker, Dr. Girish Pote, who's been talking of recent advances in IVF. Over to Dr. Girish Pote.
Let me introduce Dr. Girish Pote, sir. Good morning, all. I request everyone please be seated because it's very important topic, recent advances in IVF. Parenthood is a dream that knows no age. And today we have with us master craftsman of this miracle, Dr. Girish Pote, sir, from Sai Shri Hospital. A renowned infertility specialist since last 22 years, a postgraduate from BJ Medical College. He has mentored so many aspiring gynecologists in BJ Medical College. His expertise as an IVF specialist lies in treating couple over and above the age of 40 years. His remarkable success stories, including helping a couple achieve parenthood after 24 years of marriage, are truly inspiring. So let's open our hearts and minds to learn regarding recent advances in IVF from Dr. Girish Pote, sir.
Very good morning. So today we will deal with or learn something more about IVF. Last time also I have spoken about IVF. So today I will be speaking what are the recent advances in the IVF. First we will cover some basics in IVF and then we will go to the recent advances. Now what is IVF? IVF is basically, nowadays it's a very common infertility procedure. If you see the incidence of infertility, around 15 to 20% is the current incidence of infertility in Indian population. So out of this 15 to 20%, almost 2 to 3% will require IVF. Now in IVF what we do is, we remove the eggs from the ovaries. First we give injections for 10 days to the female. We grow the follicles. We remove the eggs from the follicles and then we fertilize it with the husband's sperm and we make the embryo. These embryos are then transferred back into the uterus. So that we will see stepwise. Till date, more than 10 million babies are already born with IVF in the world. More than 600 live-born babies were born in Sai Shri Infertility and Test Tube Baby Center. Now first let us see what is the normal anatomy. Here you can see the uterus, both fallopian tubes, ovaries. Before understanding IVF, first we should understand how the normal pregnancy takes place. So here you can see Here you can see the uterus.
A cohort of
Here you can see the ovary and the egg growing in the ovary. This is the dominant follicle. This follicle secretes estrogen. Due to this estrogen, the endometrium grows. During ovulation, you can see that the follicle ruptures. Now this is the growing endometrium under the effect of estrogen. So once the follicle is mature, it will rupture and the fallopian, you can see the fimbrial end of the fallopian tube. So it will receive the egg. During this time, if the intercourse occurs, the semen gets deposited in the vagina. From there, the sperms will start traveling towards the tubes. Now this you can see the sperms are traveling through the tube, and in the infundibulate part of the fallopian tube, the fertilization will take place. So only one sperm will enter into the egg though you can see so many sperms. After fertilization, the embryo will travel back into the uterus. It takes around 5 to 6 days for the embryo to reach the endometrium. During this time, you can see the embryo developing into 2 cell, 4 cell. On day 3, it will be 8 cell embryo. On day 4, it will be morula, where numerous cells are there. And on day 5, a blastocyst is formed. This blastocyst will then hatch in the, you can see in the uterus, the outer covering of the embryo. Embryo will leave that covering, and then the covering is gone. This is called as hatching, and this embryo then will implant into the uterus. So this is how natural pregnancy occurs. Now in patients where this procedure does not happen, we go for IVF. Now what are the steps in IVF? Here you can see the first slide here. The injections are there. We give injections to the patients. Around 10 to 12 days injections are given. By these injections, the egg in the ovaries, small eggs, they grow in size, and once the eggs grow in size, we remove the eggs through a transvaginal procedure that is called as ovum pickup or egg retrieval. Once we get the eggs out, the eggs are cleaned or denuded, and then we inject the sperm into the egg to form an embryo. And these embryos we are growing for around 3 to 5 days, and later on again we transfer them into the uterus. Now we will see one by one. This is please play the video. Now this is the video of ovum pickup or egg retrieval. You can see this is enlarged ovary. Normal ovary is not this big. Because of injections, the follicles have grown in the ovary, and you can see the ovary is this is the follicle. This follicle contains follicular fluid, and that fluid has the ovum. We cannot see the ovum by naked eyes on sonography. So with the help of a transvaginal guided needle, you can see the needle is coming through the vagina. It enters the follicle, and the follicular fluid is sucked out. Once the follicular fluid is sucked out, this fluid is then screened by an embryologist to find out the eggs. And these eggs are then separated, and then they are put in the incubator. Once the eggs are found, the eggs are covered with other cells like zona granulosa cells. These cells are first removed. It is called as denudation. And the egg is then separated after removing the eggs. After this, the egg is injected with the husband's sperms. So that is called as ICSI procedure. So this is how you can see this is how the procedure of ovum pickup is done. This is another ovary. Now we will see what is ICSI procedure. So here you can see this is the holding pipette, and the other one is injecting pipette, and you can see a small black dot going through the injecting pipette into the egg. This is all done under microscope. See, the black dot is now going into the egg. Once the sperm is released into the egg, this ICSI is done, and later on embryos are formed. On 24 hours after the ICSI, you can see this is 2 pronuclear stage on day 1. Day 2 you can see 4 cell stage. Day 3 you can see 8 cell stage. Day 4 morula. Morula is many cells which are compacted, and day 5 is the blastocyst. In blastocyst you can see a small cavity. This is how day 5 blastocyst is seen under microscope. Here you can see the peripheral small cells which are called as trophoectoderm, then inner cell mass, and the blastocyst cavity. Once the blastocysts are formed, we then grade them. So depending upon the cavity, they are graded as 1, 2, 3 or 4. When the blastocyst cavity is less than 50% of the size of blastocyst, it is 1. If it is around more than 50%, then it is grade 2. If it is full cavity, full blastocyst is filled with cavity, then it is grade 3. And grade 4 is when the blastocyst has expanded. Here you can see the size of the blastocyst is slightly bigger and the zona is thinned out. So that is 4. Now this is depending upon the blastocyst cavity. Then depending upon the inner cell mass, if the inner cell mass has lot of cells which are tightly packed, then it is A grade. If the cell mass is less and loosely packed, then B grade. And if the cell mass is very less, then it is C grade. Trophoectoderm cells are the peripheral cells. If the cells are well organized and more in number, then it is A grade. If the cells number is less and not well organized, B grade, and C grade is when very few cells of trophoectoderm are seen. So usually blastocyst is labeled as grade 3AA. So we have to see all the 3 factors, then grade 3AA, grade 4AA. So grade 4AA is supposed to be the best blastocyst which can give us maximum results. So this is how we grade the embryos and then we transfer them. Here you can see the embryo transfer procedure. This is one person is doing transabdominal sonography and one person is transferring the embryos vaginally. This is uterus. You can see the ET catheter entering into the endometrium. It will reach up to the fundus and then the embryos will be released at the level of the fundus. See, these are the embryos entering at the level of fundus and gently then the catheter is taken out. After these 15 days, we will be doing the beta HCG test to confirm whether this patient is pregnant or not. So this is how IVF is done. These are all basic steps in the IVF. Now, in which patients do we do IVF? The first indication for doing IVF is tubal pathology. If the tubes are blocked, then we have to do IVF. Like in patients who has undergone ectopic pregnancy in both the tubes or bilateral hydrosalpinges are there. So such patients will require IVF. Second indication is unexplained infertility. No abnormalities detected in male and female partner, but even after 3 years of treatment with tablets and IUI, still patient is not conceiving, then we go for IVF. Third indication is male infertility. Around 40% is the incidence of male infertility. So 40% male is responsible, 40% females are responsible, and in 20% cases, both partners are involved. So in male infertility, when the sperm count is less than normal count, that is 16 million, we indicate IVF. If the sperm count is very less, then we advise ICSI to the patient. The fourth indication is endometriosis. In endometriosis, the inner lining of the uterus, that is the endometrium, it goes through the fallopian tubes into the abdominal cavity and gets implanted there. And during every cycle, the patient bleeds inside the abdomen also, like